All right. So welcome everyone. We are really excited to have this session where we get to hear about our wonderful global partners across the world and just to kind of see what everyone is doing. And we're hoping this will just kind of help build the synergy to keep that conversation going about HPV. So as Chris mentioned, we have some new partners here on board, and we also have our long-standing partners too. So which is great. So that means that we're slowly spreading and picking up more partners across the country. So my name is Jessica Wells. I am an assistant professor at Emory University, located in Atlanta, Georgia, in the U.S. I'm serving as the moderator today alongside with Chris, and I'm also a member of our advocacy and advocacy committee for campaign and advocacy committee for IPVS. So let me get started. So as I mentioned, we will hear from 3 of our global partners today. Earlier today, we had session A, consisting of No Man Island and the Cancer Foundation of China. And today's session will consist of HPV Cancer Alliance, HPV Global Action, and Cervivor. So 3 of our partners that is doing great work, and look forward to hearing about it. So our objectives for the sessions is, as mentioned, is just provide an opportunity or a space for our partners to exchange ideas, tell us what is working with where they're at. Love to hear the boots on the ground type information. So a lot of times, our campaigning could be very high level, but what it means when it trickles down to the folks on the boots on the ground, that is the information that's really important and will help guide our mission. And also just to strengthen the global network, what one person's doing on this side of the globe and on the other side of the globe, and try to find those synergies and find those relationships, what is working, what is not working, in order for us to all have the same mission as to spread information about HPV, raise awareness and to raise action about HPV. And hopefully this is all inspiring for us to grow our network. Our network is slowly growing, and we're hoping to get more networks and partners on board to really have a reach on all ends of the globe. So just a few housekeeping rules. If you haven't done so already, please put your name and the organization that you're from in the chat box. We like to have this as a dialogue, but if you wish to say something, add a comment, or have a question, please raise your hand and we will call. Use the chat function for your questions or comments. And also, before you speak, just to give us a brief introduction of who you are and where you're from. And unless you are speaking, please have your microphone on mute so everyone can be heard. All right, so this is our agenda for the hour. As mentioned, we have a lot to squeeze in. So I will be the host. We will hear from partner updates from 3 of our global partners, and then we'll have a time for a discussion and questions, and then we open it up for just open podium for us to raise topics or any relevant issues or important issues that you would like to bring to the table for partner input and discussion. All right, so quick campaign news. So our campaign 2023, our preparations are underway, International HPV Awareness Day. We are using the same theme as last year, One Less Worry theme. That theme is actually one of our very successful themes, so we decided to keep that momentum going and continue it for another year. We will have some new materials to offer during the 2023 campaign, One Less Worry campaign. We will have a focus on vaccination. We will have videos and new posters that you can tailor to your patient population or to your community population. We also include a screening focus, which will include a 30-second video and also a TikTok. So we're starting to bring in more of our social media. I know that is moving into a very where we are into an age where a lot of things are shared via social media. So we want to leverage those platforms as well as part of our communication and awareness strategies. Quick reminder, our International HPV Awareness Day for 2023 will be celebrated on Friday, March 3rd. In the previous years, it was March 4th, but that unfortunately falls on a Saturday, so we will observe it this year on March 3rd, or Friday. So please make that quick note in your calendars. And also, I'd like to make a quick plug for the IPVC conference, which will be held in Washington, D.C. this year. I'm sorry, for 2023 in April 17th through the 21st. Our theme is coming together for HPV elimination. So the IPVS Campaign Committee and Conference are planning several possibilities for HPV awareness and advocacy activities in and around the conference. So we definitely welcome our new partners that have joined the campaign in recent months to attend. These are a few of our new campaigns that our new partners that we're really excited to have on board. Kids of Tomorrow Foundation, based in Nigeria. Cornelia Daifon Health Foundation, I'm sorry if I mispronounced that, located in Namibia. The European Network of Trainees in Obstetrics and Gynecology, which is a pan-European foundation. And yes, the Young Emergency Scientists located in Zambia. All right, so next we'll move on to our partner updates. So our presentations will be about 15 minutes each. If you, there will be some room for questions and comments at the end, and also room at the end as well. I see the chat box is going off, so I'm hoping that's everyone's name and where you're located, and we will get started without further ado.
Floor is yours, Lillian.
Thank you. Hi, everybody. Great to see you. I know a bunch of you, and I'm happy to see you here. I had anal cancer 5 years ago. So I'm 5 years out, which is a nice, it's a milestone. And it presented in the way of a hemorrhoid. I know what hemorrhoids are, and this particular quote unquote hemorrhoid wasn't going away. And I went to my gynecologist and I said, something's wrong. I have, some bleeding when I go to the bathroom, number 2. And she said I was fine. And I said, I don't think so. And this is actually even after she did a rectal exam. Now, a lot of gynecologists, I could say right now, they're not on the same page. Some gynecologists do the rectal exam, which they should be doing. It's part of a pelvic exam, and some don't. She did, and she still didn't catch it. I went to my gastroenterologist, and he said, we're going to do the most embarrassing test ever. And he did an anoscope, he performed an anoscope, which is a scope, goes up the butt. And when he was finished, he didn't look at me, and I said, uh-oh. And then he said, tomorrow we have to do a sigmoidoscopy. And I said, well, what's that? And he said, it's like a colonoscopy, but it looks at the sigmoid, the anal canal. And sure enough, the next day when we did it, he came over to me and he said, you have cancer, you have cancerous tumor. And I was like, what? Like, it was just surreal. I was, because I knew I was healthy and everything. And I was like, what is this? And he said, I don't know, but it's treatable. And that's the only words I really heard. I wasn't looking like, oh my God, what if? I was just like, okay, it's treatable. And then I did my 6 week of NIGRO protocol, which is the protocol for anal cancer. It's over 30, 40 years old. That also needs to be, addressed. It has to be updated, but 6 weeks of radiation, 6 weeks of oral chemo. I did very well. And then when I was finished, I wanted to thank everybody, all the doctors and the nurses, and have a big party in New York with everybody. I had it with toilet paper centerpieces. I had a cake in the shape of a butt. I had a pinata in the shape of a butt, and all the doctors were the last ones to go. And I turned around, it was a Saturday at 5 o'clock. I said, oh my God, the doctors are still here. It must be a good party. So, but during my journey, I encountered quite a few people that made an imprint on me. And one of them was a lady. She must have been in her late 60s, early 70s, and she was crying. We were both waiting for radiation. And I started to talk to her, and she said, oh, I have anal cancer, and everybody here has breast cancer. I could see, by the robes they're wearing. And I said, no, I have it too. I said, come on, we're going to be okay. This is the worst. This is the best of the worst. We're going to be fine. And she said, no, I'm stage 4. It went to my lymph nodes. And, when this kind of cancer goes to stage 4, just like many of them, it's not so good. And, it spreads. So in speaking with her and various other people after speaking with her, the thread was, it's not being caught. It's not being caught. It's being misdiagnosed. And I thought, wow, here's an opportunity to speak about this, because if it happened to me, it could happen to anyone, because I was healthy. And wow, like I almost felt like, when you go somewhere and you get this amazing dress or something on sale, and it's like, oh my God, I have to tell everybody. So I wanted to just tell everybody, wow, do you even know what HPV is? Do you know that it causes 6 cancers? Do you know there's a vaccine for it? And so that's when I did a lot of volunteer work for Justine Almada's foundation, the Anal Cancer Foundation. And I just started talking to everybody. And of course, there's people that will walk away. They don't want to hear it. And you know what? That's their problem. I don't care. I'm going to keep talking. So at that point, I met Dan Lifton, who, long story short, is my immune system was down, and my white blood cell count was very low. And my gynecologist, a new one at this time, a GYN oncologist from Sloan Kettering, told me, you should take these vitamins. They're really good. They're supplements, and they're mushroom extract. They go after the natural killer cell. They have natural killer cells. They go after the bad guys. You should take it. I give them to all my patients. Well, anyway, I started to take it, and I ended up running out of them, and I went online to order more. And I was like, oh my God, this company is located just 30 minutes north of New York City. I'm just going to call the company. And then I called the company, and I asked to speak to the CEO, and Dan Kid's around with me now. He's like, I have people that block people from you from getting to me, but somehow you got to me. And he called me back, and he encouraged me to start this organization. And I said, okay, you're right. So, and then alongside, I saw a social media post that Marsha Cross had the same cancer. And I got in touch with her through a connection. And in the beginning, she was, not so on board, because, she's an actress, and, she just gotten finished with treatment. And then she thought about it, and she called me and said, you know what? I do want to do something about this, and I want to get the word out. So then the organization was found, and here we are, the 3 founders. You can advance, Chris. So our vision, as you can see, we want to eliminate the HPV attributable cancer deaths through prevention, early detection, effective treatment. And we want to get everyone together to educate patients, caregivers, doctors, healthcare professionals on HPV and HPV-associated cancers. I'm actually at a conference right now in DC for bio, and on another floor, there's a conference for American Academy of Nursing, and after I'm finished with this, I'm going to run down there and find out who the main person is, because we need to educate them too. Because when I have patients coming over to me and saying, I didn't know you could get the vaccine to age 45. My nurse or my PA said I can only get it till 26. This was approved years ago. So why don't they know about it? So I am ready to talk to everybody. So here we do patient education and advocacy, physician education, engagement, and policy and procedure, which I'll talk more about a little later when we go on to the following slides. Here's just some of the social media, some of the things, you know, I don't, but I have a wonderful intern that's helping with doing the social media posting, you know, for the 6 cancers that come from HPV, which, as you know, oropharyngeal, anal, vulvar, vaginal, cervical. So, you know, we're out there. We have influencers, Jamie Henner on that last slide on the end. She was on, she's an influencer. She was on Married at First Sight. And when she was pregnant with her first baby, she found out that she had HPV. And that was a whole new thing for her, because she didn't know she had HPV. And that's another thing I want to bring attention to. There's a couple of things. Number one, when you go to your gynecologist, especially in the past, hopefully it's different now, but when you go to the gynecologist and they tell you you have abnormal cells, they really need to say, they need to tell you you have HPV, because you're not making the connection. And then I recently went to a new gynecologist who I'm not going to go anymore to, but I brought a friend, and she did the co-test, which is the HPV test. She did it on me and she did it on my friend. And after I asked my friend, did she do the HPV co-test on you? And she said, I don't know. And then later on, I called the GYN and I said, my friend didn't know you did the co-test on her. And she said, well, we don't really talk about it unless, you know, it comes back positive. And I said, you know what? I think it would be a good idea if you tell the patients what you're doing on them, because then they can make the connection of the acronym HPV and the commercials on TV for the vaccine and all this type of stuff, because people don't know about it, and they should know about it, especially if you're doing, you know, the tests on them. So, you know, we do a lot of that kind of work. One of the things that we were active with is the town hall. The town hall. We had Kathy Castor come on. We did a town hall that she started this act, Prevent HPV Cares Act 1550. It's now sitting with the Senate. It was passed by the House. It's got to get passed by the Senate. And actually, here I am in DC, and I already spoke to a few people in policy, and we want to go to the Hill, and in March, probably with Marcia too, because she's very passionate about this. We want to make an HPV Cancer Awareness Month, not just HPV Cancer Awareness Day. We want to bring more attention to it. It just amazes me, I'm sure it does to all of you, that, you know, it's 12 years later after Farrah Fawcett died of anal cancer. It's, you know, 5 years after my diagnosis. It's 10 or 11 years after Justine from Anal Cancer Foundation's mom died. And people still don't know what HPV is. And I'm not trying to rank on the doctors. You know, Marcia Cross, she actually had no symptoms whatsoever. She was late for her annual exam, and her doctor said to her through a rectal exam, I don't like what I'm feeling. You need to see the colorectal doctor. And she said, what? I have to pick up my kids from basketball. And the doctor said, the GYN said, no, you're going to see the colorectal doctor. And she did. and stage 2, like me, anal cancer. So that's the other thing I want to point out, with the doctors, with people in general, these cancers are affecting a lot of postmenopausal women and men. I mean, men of all ages, for anal, oropharyngeals on the rise. But the postmenopausal women, the ones that think, the ones that have been married a long time or divorced or, whatever it may be, they didn't get the vaccine because it wasn't available to us. It came out in 2006. And these are the people that are getting these cancers, like me, my early 50s, Marsha, also early 50s, other people that we know. And, there needs to be attention to that because they have no clue. I have a lot of patients that come to me and say, I'm divorced. I'm starting out with a new relationship. Do you think I should get the vaccine? What should I do? And so on and so forth. Anyway, moving on. So when I talked about earlier, getting everybody involved, so we started this mission partner program, and we're not the parents of it. It's just a forum for everybody that's in the space to get together and know what's on each other's radar. So we have a newsletter. We want to make sure that we put in the newsletter things that are going on in your organizations. We want to highlight them. It's gaining strength in numbers. Go ahead. So we recruited 20 plus, and we continue to recruit more. We're going to be updating the slide in a little bit. But these are some of the organizations. Some of you guys are on here, HPV and me, and the Vax to Stop Cancer, and so on. And here's a slide of the town hall that we did. There she is again, Kathy Castor, and there's Jamie. And there I am. And I'm just thinking if there's anything else. No, I know Chris, when we were reviewing this, she said to me, but what happens if you don't have a celebrity or an influencer? Well, as I learned over the weekend with Cervivor at Morgan's survivorship, you know what? You can be that person. You have reach. You could talk to everybody and anybody, and anyone you talk to, you're saving somebody's life because they have kids, parents, and so on. And that's my spiel. Thanks, everybody.
Thank you so much, Lillian. That was great to hear the momentum that you really are giving. Superstars or not, we all have the same mission. So thank you so much for that. And we're going to move right along to just to make sure we have enough time to fit everybody's presentation. I believe it's Morgan. Are you next for Survivor or?
Teresa's
No, I'm last.
Teresa's up next.
Sorry, I didn't mean to put you on the spot, Morgan. I'm sorry. Teresa.
No worries at all. Hi, everybody. You can all hear me and see my slides? Great. Thanks, Lillian. First, it was really, really wonderful to hear more about the HPV Cancer Alliance in the United States. I think because there's so many people on here, I'm going to be repetitive. Like, we're here in Canada, and so just like each one of us, our organization is based on the Canadian healthcare system. Just like, our colleague Lillian, I think it's based on the American healthcare system. And I'm sure if we had one of our African colleagues, it would be based on theirs. And it's interesting to see how, from a public policy perspective, how we're talking about HPV, how many cancers there are. We're clumping oropharyngeal cancers into one. So in Canada, we're saying it differently. It's not 6 cancers, it's 9. We're not putting an upper age limit on vaccination. So there's a lot of elasticity in the messaging I'm finding in Lillian's presentation versus, what I'm going to be covering from our angle. But I really wanted to tell you, Lillian, I appreciate your story, and I think you're very courageous for taking such a active role in the community. So thank you. My group is called HPV Global Action, IPVS Advocacy Campaign. We're an official international registered charity that's bilingual. And we actually, as we speak, have just gained our international charity status. So we're no longer just a Canadian charity, we're an international registered charity. I could tell you about me, but in a nutshell, my team, this is my board here, I started this shindig back in 2001, actually. I grew up with my best friend here in Canada. Her name's Tara. And we went through high school together, first boyfriends, losing our virginity, having 4 kids between the two of us, being in her wedding, you know, all of these things. And then one day she sits me down on her couch, me and her other best friend, and tells us that she has cervical cancer and she's going to die in 6 to 9 months. But she was only 23. So she went from being perfectly healthy, shopping at Costco in 3.5-inch heel stilettos, to then telling us, looking gorgeous and looking great, that she was about to die in 6 to 9 months. And to keep this story very short, she did an incredibly quick downward swirl and was gone in 7 weeks. And she also died on my son's first birthday on May 11th, 2001. So it was, you know, she ended up being the poster child for the most tragic story ever. To date, here in Canada, at least, she's the youngest person to have ever died of cervical cancer, still. Her story is not unique in the sense that, you know, she was overlooked and, you know, she has a very sad story. And what I had a very, very clear, great career path, big education, and I literally threw it all in the garbage. And I decided to take on this mission on her behalf to really be spreading awareness and education about HPV. So back in the day, when the vaccination came out in 2006 across North America, alongside Dr. Mark Sebin, who is also, you know, a really vocal person in the IPVS community. We're both based here in Montreal, Canada. We launched an organization called HPV Awareness, because it was about awareness. And then we started to do work together, and then we grew. So who we are, well, we're founded in 2006. We're a bilingual registered charity, and we educate individuals of all ages about positive sexual and reproductive health in the context of healthy relationships, with the objective of preventing negative sexual health outcomes. We are focusing on HPV, as we are all aware, over 75% of the population has one form or another. So what do we do? Well, we're on the forefront of developing inclusive, comprehensive sexual and reproductive health tools designed to enhance and assure positive sexual health outcomes. We connect with academic settings, healthcare professionals, and communities of all demographics all around the world. So we disseminate information regarding the prevention of STIs, HPV, vaccines, screening, and avoiding and treating HPV-related diseases. We develop partnerships, implement educational programs, and develop research initiatives. And our prevention programs empower people because we deliver clear, simple, evidence-based messaging. So our mission and our culture, you know, I don't want to go on too heavily about that. I think I want to skip right into how we are talking about HPV here in Canada. We have our downloadable brochures and posters in 16 languages now. And we really decided to really hone in on the lay populations and where they are in the learning curve. Yes, I understand that, you know, when we deal with more from a clinical perspective or a research-based perspective, you know, we have to be really careful about our wording. And we've really decided to take the line because of how diverse the population here is in Canada. We have a lot of immigrants. We have a lot of people that are English second language. We have different cultures, different religions. We have a very important Aboriginal population. So we try to make sure that the language that we're using is clear, concise, inclusive, so that all of our demographics, so you'll see, you know, in all of our imagery, we're really basing our communication methods on our psychosocial science expert, Dr. Zeev Rosberger, who's our vice president of HPV Global Action. His team is really helping lead the language. So again, when it came time to talk about the cancers, we didn't clump for pharyngeal cancers because there's multiple cancers. So it's not 6 cancers, it's 9. And we all know that number is actually growing. So in Canada, we refer to the 9 HPV related cancers. Another difference here in Canada is there is no upper age limit for HPV vaccination. Just because Merck did their clinical trials, their 3-phase study up to the age 45, does not mean that the minute you turn 46, you can't get this vaccine. And I don't know why that message isn't being, permeated a little bit differently. We're also taking away the silo effect of, oh, if you're gay, this is for you. And if you're a girl, this is for you. We're saying this is for everybody, regardless of your gender, your relationship status, your age. So we're really trying to make this a much more encompassing message so that no matter who passes through our filter, they're understanding this has something to do with them. That's something that we really are trying to focus on in our group, the way we talk. We're doing different programs domestically, meaning inside of Canada. We have webinars on sexual and reproductive health. So we do have a very heavy focus on HPV when we're doing any type of health professional webinars. It's usually about, updating them on the science behind HPV. And then we have the second half of the webinars with our CIDC partner that we do webinars for all across Canada, that we really focus on how to communicate that. So how to regurgitate that. So you're in the middle of, showing graphs and data and all this to, say, pharmacists. How are they going to then, when they're faced with, a client in their window, how are they going to take that information and talk to that person in front of them in less than 30 seconds in a way that's going to really reach that person so that we actually do translate to having behavior modifications? Because that's really what our goal is always to do that. So we're always trying to either be educating the adult population through adult webinars just for lay populations. It could be parents, it could be just people from the community, regardless of what community. Sometimes we do simultaneous translations with different cultural differences. And then again, we do healthcare professional webinars. We have our next one is around head and neck cancers. We usually do 2 to 3 a year. We also do academic programs stemming from puberty programs, pre-adolescent programs, high school, post-secondary education programs, and we're doing that across Canada. And it's all inclusive A to Z on sexual health under the umbrella of how to have a healthy relationship. And we're actually studying that through a pre and post anonymous questionnaire that we're doing the day before we do the presentation or our program, and then a month after. So we want to be seeing, is our work actually translating to people going and getting tested, getting vaccinated, asking questions? And if we're still in the business of doing this, I can tell you it's because the answer is yes, it's really having that positive impact. We've also, delved into other, sexual health issues like contraception, HIV, all the STIs. Like, we really are trying to be an all-encompassing group. So we've established, we're doing a research project on primary testing, HPV DNA testing and primary cervical cancer screening through Dr. Ziv Rosberger's lab. We put together a contraception tool. It's a web-based tool for people anywhere from the ages of 18 and over. So women and anybody with cervix can go and get information about contraception and their needs. And then our big one, I think, that I wanted to share, because I had some outcomes of the campaign last year that I wanted to share. I just want to change my screen here for a quick second. We've started branching out into our international sphere, and we're doing, sorry, here, I'm trying to find my slide. We're doing work now on the elimination of cervical cancer strategy, actually. And I just want to make sure I get this right. Here we go. So what we did is when the elimination of cervical cancer strategy came out, I think that's when our group really took a turn in 2017, 2018, where we really wanted to get more invested in the international arena around global health and what HPV Global Action could do. So this is where we really transitioned our name from HPV awareness to HPV Global Action, because it was really indicative of what we were doing. We were going from awareness to actually that call to action and making things happen. So we really got very ambitious and focused on what was happening with our elimination strategies and saw that we had an opportunity to have a real interesting overlap on different WHO targets. So we've got elimination targets on HIV, we've got elimination targets on HPV and on neglected tropical diseases. And one of the most least known that have a huge relationship with HPV is female genital schistosomiasis, which I will from here on out call it by its acronym FGS. And FGS could look like cervical cancer. And in low and middle income settings, where people are bathing in open water sources, they're coming into contact with FGS, and it's a worm that crawls up inside. It lays eggs, it manifests, and there's a lot of different programs for school-age children in lower and middle income countries that the WHO has set up to deal with this neglected tropical disease. But we have to understand that it has limited success, and there is no projects in place, and there is no way of getting a handle on this unless we start integrating approaches. So we have to get out of this silo of thinking HPV is the be all and end all. There is other diseases. So in projects, it's really an important opportunity, especially in lower and middle income settings, to take those opportunities to have an integrated approach. So our Integrate project, it's an acronym, but I want to share this quick video with you that we did with Ted Danson to kind of talk to you a little bit about the project that we're starting, I should say.
According to the Center for Disease Control and Prevention, human papillomavirus, also known as HPV, is the most common sexually transmitted infection in the world.
HPV is a virus that typically has no signs and symptoms, and it's spread via sexual activity. And as much as condoms give a great protection from unwanted pregnancies and many sexually transmitted infections, there's still those other body parts that are touching. So unfortunately, condoms aren't giving us full protection from HPV. We do not need to have a long list of sexual partners because it only takes one infected partner one time in our life. HPV can stay asleep in a person's body for up to 40 years before it wakes up. And it's linked to a long list of cancers: tonsil cancer, vocal cord cancer, tongue cancer, throat cancer, anal cancer. There's vulvar cancer, vaginal cancer, penile cancer, and what we're hearing most commonly is cervical cancer, and HPV is the necessary cause of cervical cancer.
There were approximately 570,000 cases of cervical cancer in 2018. Globally, more than 90% of cervical cancer cases and deaths occurred in low and middle-income countries.
The HPV vaccine is a cancer prevention tool. We know it is very safe, it is very effective, and it's giving you long-term protection against cancer. It's best to get vaccinated before you start being sexually active, but anyone, anytime, it's good. No matter age, sex, relationship status, or sexual orientation, HPV vaccine is a very good preventive tool.
In November of 2020, the World Health Organization adopted global targets to be on path to eliminating cervical cancer within the decade.
The World Health Organization, otherwise referred to as the WHO, has set out a very ambitious global strategy for the elimination of cervical cancer. The WHO has identified 3 specific targets that countries need to reach by the year 2030 in order to be considered to be on the path to eliminating cervical cancer within the century. 90% of girls within a country have to have received all their doses of the HPV vaccine by the age of 15. The second target is that 70% of women within a country have to have had cervical screening at age 35, and the second at age 45. And the third and final target is that 90% of women within a country who have been found to have pre-cervical cancer or cervical cancer will be under treatment. And more specifically, the WHO wants to ensure that 90% of the women who have an advanced stage of cervical cancer will be under long-term care.
In addition, about 110 million females living in sub-Saharan Africa are also at risk of female genital schistosomiasis, referred to as FGS, a disease that can often look like cervical cancer.
It's a parasite, it's a worm that goes through your skin and attacks your internal organs. It manifests itself in women as though you have a sexually transmitted disease, or it looks like cancer. So you need very good light and you need electricity, which is often not available where this disease is present. So you get it through a river, and that's where the worm attacks you and comes in. So you actually have no choice. You're using the river day in and day out and getting infected and reinfected again and again throughout your whole life. So it starts in childhood, and even little girls have stinking discharge and burning sensation in the genitals. And it lasts for a lifetime, so the whole family is affected by this.
Through a collaborative approach, an opportunity has been identified to maximize prevention efforts through joint screening of cervical cancer and FGS using automated visual evaluation in the form of a camera that uses a pattern recognition system to diagnose early changes, indicating the need to get treated by a healthcare professional.
The goal with automated visual examination, or AVE, is to find changes in the cervix that are a pre-cancer. So if we can actually identify these changes before they become cancer and treat it, we can prevent cervical cancer from developing. With AVE, we hope to have a low-cost tool that is highly accurate and reliable and can be used in the field to give an answer right away to see if the cervix of the woman exhibits any signs of concerns. If these are observed, the problem can be addressed, and this can greatly alleviate suffering for the women.
As international leaders in community health promotion, HPV Global Action and Bright Academy are bolstering collaboration to improve prevention, screening, and treatment, focusing on areas in the world where women and their families are most impacted.
HPV Global Action and Bright Academy are working together to develop partnerships in the delivery of services for cervical cancer and female genital schistosomiasis in developing countries. These partnerships are critical because there's no better way to do it. One of our concerns is the long-term sustainability of these innovative programs. What we are attempting to do is to bring a basket of services to women in the developing world in the most timely, efficient, and effective manner. Not just one disease and one focus, but as many as there are endemic to those parts of the world.
So there you have it. That's kind of like a crash course a little bit on the link. So we've added HIV and soil-transmitted helminths. So soil-transmitted helminths is another neglected tropical disease, and people come into contact with it when they walk on the ground in bare feet, amongst other ways. But so we've incorporated these 4 diseases, HIV, HPV, FGS, and soil-transmitted helminths into a project, and it's called the Integrate Project with our partners at NIH and Bright Academy. And we're launching this in Eswatini. Some people might know it as Swaziland. The name of the country changed a decade ago. And we're actually in the middle of launching that right now. And we'll be starting by March to really be collecting data in Eswatini. So that's what we're currently doing. And the goal will be to take a look, first of all, at this integrated approach, integrating AI. Also, we're going to be better situated in Eswatini than we are in Canada in some senses with our cervical screening. And then the idea will be to scale this up to other similar settings and really show the positive approach when we all work together. We have a lot of learning we could do from other similar diseases. So that's the overlapping that we're trying to create. So as far as just to switch gears really rapidly, our campaign that we did to support IHAD in Canada, we didn't really touch the campaign too much last year. We did it bilingually, so we added our own little taglines. We really wanted to focus on the screening element and the vaccine element, and we did a little local events throughout the country. We did our professional webinars in English and in French, where we were really talking about addressing misinformation. We're trying to get away from talking about things we've already been talking about. This is like a problem I feel we have. We keep saying things that we already know. I'd love us to start having conversations about new things, controversial things. Like, how do we feel about a one-dose schedule? Why are we spending so much time talking about which test is the best high-performance HPV DNA test? Like, why can't we change the conversation instead of continuously reapplauding this old agenda? Like, we should be pushing past that. So we're really trying to do that a lot here in Canada. So we were on billboards and in different places around the country last year. We've really been focusing a lot on using patient testimonials. I think that I don't know if everybody identifies with celebrities, but that Mr. Madame person down the street, we found that a lot of people identify with that regular person. So instead of us trying to spend all this money and allure these highly, solicited big people, we've turned the other direction, and we want to talk to that regular person and get their story. And we've had an immense amount of success because we're hitting different demographics, different ages, different cultural backgrounds. And that's the direction that we seem to have found the most success here in Canada. Another angle we took was really to throw the spotlight on athletes, because athletes don't have anything wrong with them. And, they're that perfect population that everybody looks up to. So we really wanted to throw them in the line of fire and really focus on boys, especially here in Canada. We have, nobody in I'm being sarcastic, by the way, when I'm saying this right now. We seem to have it under our mindset that if you're an athlete, you can't be anything but a heterosexual. And then, we attach, the stigmatism of being gay, HPV, and all these other diseases. So we're really trying to put a focus on our young male athletes standing up and being like, no, this is for us. We also get these things, and we all need to be protected. Again, this was a really good campaign message here in Canada, especially because we were attacking an age that missed and fell between the cracks when we included the boys to the recommendation for vaccination. So all these boys, literally, I know every one of those boys that are in this picture right here, and not one of them had the opportunity to get the vaccine at school because they were the wrong age at the time. So we were really trying to hone in on that lost cohort in our advertising. So this year, this is the direction we'd like to go here in Canada. And the reason we'd like to take it this direction and add HPV can be one less worry is because we did a lot of focus groups with all of our different parts of Canada, whether they were in high school, college, our parent groups, our Indigenous focus group. And the one big thing that kept coming back as our feedback was one less worry about what? Like, what are you talking about? And then they mentioned that they saw the IPVS logo at the bottom, and they're like, what's IPVS? And then you see HPV Day, what's HPV? So it was like there was this cross section of confusion. So we decided that because we loved what we were able to accomplish with the campaign last year and the color scheme and the fact that we're doing it again this year, what we would like to do here, at least in Canada, is add in front of it, HPV can be one less worry. So that it's not this elusive comment. We really wanted to address this overlapping feedback we had last year that people just didn't, like, they would have liked to have had a little bit more understanding about one less worry about what in the title. So that's something that we would like to offer as a suggestion that maybe others can maybe have feedback about this. We haven't gone anywhere with this yet. We're still putting together our campaign ideas, but that's one of the ideas we're rolling around here. Some of the things that we found helpful with our campaign is keeping our messaging clear and concrete and not being these large messages. So like we wanted it to be really simple language where we stayed away from big wording. Adding our personal touch to the materials given by IPVS. We were so grateful that the way the campaign was designed, you could add your own personal flavor. So that was something that we really enjoyed. Linking people to resources whenever we mentioned cervical screening or HPV vaccination, we felt that that was an important thing to do. You know, we're always looking for that call to action here in Canada. Like people really like that and appreciate that. Not only are you telling me to get the vaccine, I don't want to have to dig for it. So give me that QR code where I can jump on there and see how it applies to us. And focusing on the general population with simple and relatable language was the other thing, and not making it be about cervical cancer, not making it be about head and neck cancer, not making it be about HPV. And when it came to prevention, really referring it to it as a cancer prevention tool and keeping the language very macro so that people could really bite into that information. Again, our educational materials, we spread across the country. They're in hundreds of healthcare centers and pharmacies across Canada. So we have, we're trying in Canada to update our archaic pap tests. We're still offering, unfortunately. So we're now pushing towards adjusting our cervical screening to be done with the HPV test. So we're really promoting that at medical settings. So we have a poster for that. Then we have our pamphlets on HPV and the vaccine, where it's an inclusive, very macro recommendation for everybody to take a look at. And then the posters that are being used in medical centers as well. And we welcome anybody to go on hpvglobalaction.org. You can use our resources as much as you'd like, or discuss with us how you can make them apply to your country. Because again, you know, I compare our presentation to the previous one. I'm in Canada, so what's happening and what I'm allowed to do here versus what other countries are allowed to do will also probably be quite clear. So we've really tried to make this clear for Canada. And on that note, this is how you can reach us if anybody wants to discuss with us more concretely. And on that note, that's it for me for what we're doing over here in Canada.
Thank you, Teresa. And there are some comments in the chat box if you can share that video or a link to the video. So I know we're on top of it. Yes, go ahead. I'm sorry.
I'll definitely send it. I could actually put the link in the chat. What I'll do.
Okay, perfect. And we're on top of the hour. We do want to squeeze in one more presentation. If you could stay behind, please do. We'll definitely leave this room open for those who could stay past the hour so we can keep the conversation going. But without further ado, Morgan, thank you with being here with Cervivor.
Yeah, thank you for having me. Can you hear me and can you see okay?
Perfect.
Great. So hi, everyone. My name is Morgan. I'm a social worker and I serve as the community engagement liaison over at Cervivor. And just a heads up of who we are, our mission is to empower patient advocates across the globe to share their stories, to educate them, and really bring in that grassroots action to make change happen and ultimately end cervical cancer. But I would be doing a huge disservice if I didn't go through and tell you my story and how I got to where I'm at, because I feel like I am a prime example of what we do here at Cervivor. So my story began at 24. You know, I was hanging out with my friends. I was very social, just started getting into a new relationship. Many people don't know, but I was a former dental assistant. That was a good part of my, 8 or 9 years of my adult life. And I was having I wasn't having any symptoms except for some abnormal bleeding after intercourse. Didn't think anything of it. to be quite honest, I was very naive about that symptom. I was always one that went in for routine screenings, very active in my health since I was a young woman. And I had my first abnormal pap test results come back. And, I didn't think anything of that either, because all of my friends at some point had an abnormality and nothing was wrong with them. So what could go wrong with me? So I was referred for a colposcopy and went through that testing process. I was actually hemorrhaging on the table as they were doing it. So they stopped and referred me to a gynecologic oncologist. I wasn't connecting the dots at what oncologist actually meant. So on February 4th of 2015, I went into my appointment by myself, and I was diagnosed with endocervical adenocarcinoma on World Cancer Day. And I just remember hearing, "You have cancer," and the rest, I completely zoned out. I was alone, I was scared, and I had a lot of emotions coming up. It was a lot of shock to hit me at once. So I went through the treatment process, but before I started that, really I wanted to get answers on my fertility and what that meant. I didn't have many of the answers when I went, so I ended up getting started with my chemotherapy and radiation, and I wasn't a candidate for surgery. But I went on, and I ended up having a metastatic recurrence in my lungs almost a year later. And the picture below of me bald is the moment that I decided I was so tired of feeling the way that I felt, that I was frustrated that my body was betraying me, and that I wanted to do something to make my story matter. So literally after I finished treatment, I was on Instagram just kind of scrolling through looking for a community, and I stumbled across the hashtag Cervivor, and that's CERVIVOR. I found out that they had a patient advocacy retreat for cervical cancer survivors, and I signed up, fundraised my way through, and it was life-changing. It was life-changing for me, because I learned more than I did during treatment. I knew what kind of questions to ask. I knew where to look for the information, and I really took the tools that they handed to me to become a patient advocate, and I jumped into every opportunity that I could get. And these are just some of the opportunities that I did locally. I'm from Iowa, and I jumped into policy work and working with our early detection program, partnering with even my treating oncologist at the Mayo Clinic, who shares my story now because of the patient advocacy portion. I'm very fortunate because I had a 6 to 9%. I fell in the 6 to 9% percentage of having a complete interval response. So I don't have any evidence of disease. I'm 6 years out, and I couldn't be more grateful for that. But I continue to make my story and my survivorship count. I've done so much over the past 5 years with Cervivor. It's really empowered me to share my story, but also to support others doing that as well, and partner with several leaders, even across the globe. So this is only a fraction of what I've done because I felt heard and because I was taught the necessary tools. So Survivor School is something that our organization puts on. It's only one of many things that we have going on, but it was established in 2014 by Tamika Felder, who was also diagnosed at a young age of 25. She created what she didn't have, and before she had Tamika and Friends as her organization. and they used to host a house party of 5 with friends and family talking about HPV and cervical cancer and how they can prevent it. So it officially became a program in 2014. And our curriculum takes a full biopsychosocial approach to the cervical cancer experience. And it is life-changing. We combined the emotional and social components with the medical. In the past, we've included HPV-related cancer survivors in previous schools because we knew that the resources were scarce for some of them. We had a community with open arms. We've hosted an HPV school with the Nebraska Immunization Coalition in 2018. That was a really cool experience. Only like a 2-hour drive from where I'm at, so it was no problem to head down and be a part of that. But with the pandemic and the statistics of vaccinations being delayed, cancer screenings being delayed, we knew we had a lot of work to do in sharing credible information and partnering with people that we can make a difference, but we didn't have to do it alone. So St. Jude approached us and they became a partner to financially support the work that we do. We use the curriculum that we developed years ago for Survivor School and really put it towards HPV-related cancers and how we could further our advocacy footprint for HPV-related cancers. Because we know our stories and active advocacy can spread our survivor footprint and really truly make a difference across the globe. As you can see in the middle, we participated last year in a social media campaign. But we also have, as part of Survivor, we have patient advocates representing the patient voice on several panels that develop guidelines and screening guidelines. And it's just one part of what we do, but it makes a huge impact. So with the HPV Survivor School, we had 30 graduates and it just wrapped up this past weekend. So Lillian is included in this number of graduates we have, and we left them with a call to action to go out and start making those partnerships with their local community and our global community. And we are really honing in on the HPV Awareness Day as well. So please partner with our patient advocates and include the patient advocate voice. And that's how you can help by supporting our efforts. Refer your HPV patients and survivors to our Facebook group. We have a private one on our Facebook page that you can find fairly easily under our groups tab. I also have a QR code that you can scan and connect with all of our social media pages. But also to support us, donate to organizations like Survivor who are doing this crucial work. For Survivor, there's only a team of 2 of us, but we're making such a global impact between, our partnerships. And then recently, our founder was given the opportunity to give opening remarks for the First Lady, Dr. Jill Biden, and the American Cancer Society's launch of the Breast and Cervical Cancer Roundtable. So it's been a very exciting week, and just very appreciative of being here. So this is our main social media contacts. You can scan that QR code, and Chris, if you want to send out these last 2 slides, I'll let you do that as well, because I know we're getting short on time. And then I have my personal social media, and if you would like to reach out to me, feel free to. I'm happy to hear from everyone and see what we can do as partners and how we can share our survivor stories. So I really appreciate the time, and thank you for having me.
Thank you so much, Morgan, and thank you to all of our partners for coming today and sharing your stories. They're very inspiring and uplifting. I think we're all touched by HPV in some way, either personally or through a friend or a family or loved one. So like I said, that is what that's our string to our fabric that ties us together with the mission. So thank you again, Morgan, for that. Lillian had to step out, but we're at the top of the hours. If you have any questions, please feel free to chat, or if you have any parting comments, we could probably take 1 or 2 minutes left. So. And I was telling Lillian in the chat box, I'm not sure if she caught it, I'm a fellow of the American Academy of Nursing. So yes, please engage us. Me as a healthcare provider, I know anal cancer was not on my radar until I came across the alarming statistic that is going up. So that's my field of research, is HPV related anal cancers, and just really trying to fill those gaps in knowledge. And I think Teresa mentioned even just expanding, our awareness and our education. Is not just cervical cancer, it's head and neck cancers, it's anal cancers, and how we can really update some of our educational strategies. Mr. Ding, did you have you have your hand raised? Do you have a quick comment you'd like to share? Osman, I'm sorry if I pronounced your name incorrectly.
Yeah.
How do you pronounce it? I'm sorry. The correct pronunciation.
Hi.
Hello.
I ask your indulgence for my English because I'm a francophone. I'm Dr. Jang Usman from Senegal. I'm a gynecologist specialized in gynecological cancer, and I'm the General Secretary of Senegalese Society of Colposcopy and Pathology related to papillomavirus. I want to thank the IPVS to share our experience as a new campaign partner. I know that the time is over, but I have prepared one presentation because it will be for another time. I think because yes, the time is over.
Jessica, Dr. Ying wanted to present this morning. He would prefer to present in French. So my idea is to record it and then see about getting it subtitled in English for those of us who cannot understand French. And then we will make it available to share across our partners. Is that all right with you, Dr. Dieng?
Yes, it's all right. Okay.
Okay, so anybody who cannot follow French, don't be shy to say goodbye right now. If you want to test out your high school French and see what you can follow, then please remain with us. And otherwise, my thanks to the 3 presenters that agreed to share the updates today from their organizations. It was great. I regret that we don't have a little bit more time for questions, but this is a formula we keep working on till we get it right. Last time we had time over and not enough questions, so yeah, that's the way it goes. Anyway, thanks everybody. I'm staying on. I can speak a little, understand a little French, so I remain. Plus, I record the thing, so I better start sharing.
Okay.
Yeah. Thank you. Yeah. I'm going to present you the Senegalese Society of Colposcopy and Pathology related to papillomavirus, and the theme of the presentation is "On the Road on the road to eliminating cervical cancer. And you have to see the data of cervical cancer in Senegal, where we have 2,000 new cases. If we report to Global Can 2020, with a low screening rates of cervical cancer, less than 10%. The cervical cancer is the first gynecological cancer in Senegal, and we have a national strategy built on three points: vaccination, screening, and early treatment. And the strategy of screening is screen and treat, recommended by the WHO. And the Senegal achieve the commitment to elimination of cervical cancer according to the WHO global targets to vaccinate the girl 90%, and the vaccination is available in Senegal since 2060. The second strategy is to screen the targets, and the goal of screening is 70% of the targets. In Senegal, the national guideline recommend BIA like strategy of screening. The HPV test is in the beginning. And the third target is to treat 19% of cancer or pre-cancer lesion diagnosed. And in Senegal, thermoablation, lips, surgery, chemotherapy, and radiotherapy are available. And we created the Senegalese Society of Colposcopy and Pathology related to papillomavirus. In the beginning, it was a group WhatsApp who born with the diploma of colposcopy. And we created a group WhatsApp where the students exchange their program and also their experience with WHO appeal to eliminate cervical cancer. We feel the need to create a society, and the society, the Senegalese Society of Colposcopy, was born. Our first activity was in 20 and 21, and where we celebrate for the first time the campaign, and we have a partnership with IPVS, and we organize a journey of depistage and treatment of pre-cancer lesion. It was one journey where you have 20 experts. We make 100 colposcopy, 10 pre-cancer lesion was diagnosed. We make 50 biopsy, 17 thermoablation, free lips, and we have make many press points. And for the next year, this year, we participate to the campaign, the International HPV Awareness Day, and our first Congress was the 4th of March 20 and 22. And we have make one conference of press, 4 TV emission, 5 radio emission, 10 interviews, 10 seat internet in line. We realize 100 video where many of leaders of all the segment of the population engage to participate to elimination of cervical cancer. And we also make a school tour where we go to the school and to make the sensibilization with the young people. We distribute 2,000 t-shirts and caskets and gadgets. We make also a video, national video of plaidoyer for the elimination of cervical cancer with vaccination and with the screening. You can see this this photo who illustrates the campaign we have made, and the Congress was a Congress of bimodal aspect, online and virtual and presential. We have 250 participants. We have 15 specialty, 13 session, 20 communication, 6 literature review, 3 conference, 2 workshops, and 1 symposium on vaccination. And Max Steben participate in the name of IPVS in our Congress. We have too the participation of Jean-Marie Dango from OMS Afro, who animate an virtual session. The first Congress was in the nice place of Dakar. It is called la Porte du Souvenir, la Place du Souvenir. And we were very happy that the International Papillomavirus Society en tout cas raconte notre histoire comme une success story dans ces pages. Quelles sont nos perspectives now? What we plan to do is to continue the mediatic sensibilization, and we prepare now une caravane nationale qui va sillonner plusieurs régions du pays pour faire des traitements gratuits, parce que pendant le mois d'octobre, il y a beaucoup de femmes qui sont dépistées, mais elles n'ont pas accès au traitement parce qu'elles habitent loin. Donc, nous, notre association, on fait une caravane et on sillonne l'ensemble du pays pendant plusieurs jours pour offrir des traitements spécialisés à ces femmes qui sont dépistées sans pour autant être traitées. Quelles sont les perspectives pour l'année 2023? Donc, c'est la célébration de la 2e édition de la journée mondiale de sensibilisation les 2, 3, 4 mars. Donc, qui va coïncider avec notre 2e congrès. Donc, notre 2e congrès est planifié d'ores et déjà le 2, le 3 et le 4 mars. Et nous vous invitons tous et toutes à venir participer à notre congrès. Et nous attendons beaucoup, en tout cas, de l'IPVS en termes d'accompagnement et de soutien pour cette 2e édition qui aura lieu au mois de mars. Nous voulons mettre en place une stratégie zéro cancer du col en entreprise où on va sillonner l'ensemble des entreprises pour, dans le cadre de la responsabilité sociétale, implémenter le dépistage dans l'entreprise. Participer au 2e congrès international à New York, bientôt au mois d'avril, après notre congrès, et participer au congrès de l'aortique en novembre 2023. To go fast, you go alone, but if you want to go far, then you have to go together. Et ça, c'est notre leitmotiv. Nous voulons aller ensemble. We want to go together with IPVS and with all the experts and to contribute to eliminate the cervical cancer.
Wonderful. Thank you so much, Dr. Dan. You got it in. So thank you for squeezing that in. I do have a quick question for you. So with your campaign in the primary schools, is it mainly about awareness, or do you actually administer the vaccine in the primary and within school set?
Dr. Deng, we cannot hear you.
Okay.
Oh, there you are.
Oh, there you go.
Okay.
Did you hear the question?
No, I don't hear.
We were wondering if when you visit the schools,
Yeah.
if you are also administering the vaccine.
There is national program of vaccination in Senegal, and the approach is based on the school approach, and there is collaboration between Ministry of Health and Ministry of National Education, and it is the Ministry of Health who have the right to vaccine. We go like an association to make the sensibilization to the young girls that they have to vaccine.
Thank you.
Thank you. Thank you all for thank you so much for your efforts in Senegal. All right, I think we are.
Well, we turned into a 90-minute session today.
Yes, the
Thank
more
you,
the merrier.
Dr. Ramirez and Nora for sticking around, and Dr. Deng for your presentation. I will be transforming this recording into something to share with all the partners. So your report will reach many in the network. And thank you once again for your time.
Yeah, I'm going to perfect my English too.
Your English is really better than you think. It's quite good.
It's very good.
Thank you.
Thank you so much. And we look forward to continuing these sessions. So I think our next one is in January, correct?
Correct.
Okay. So yes, we look forward to keep the ball rolling, as we say in the South.